your own screen if you want, if you're finding it difficult to hear. I'm very happy to send on a copy of the slides to participants if you want to request it after this session, and we will also have a short Q&A at the end of this. We won't go into any details about any specific individuals. You can contact us individually after this if you'd like, but if there is some generic question about the service that you'd like to talk to us about, that's no problem. If we can't answer the question, if it's that we don't know the answer there and then, we will take note of your question and one of the learner support advisors or myself will get back to you. So we'll just proceed. I'll keep this as a whistle stop tour because I'm conscious it is lunchtime, people are hungry, and we'll let you go in about 20-30 minutes. So this session is it's just an introduction to our learner support service for those who may not be familiar with it. We're going to also take an opportunity to introduce our team. We're going to give an overview of how we support learners with specific needs and then give a brief overview of the other supports which are available. So in our introduction in 2023, GRE2B with the support of Solas established the Learner Support and Inclusion Service. We are part of the Further Education and Training Department, and we're situated within the overall GRE2B Inclusion Unit under the management of Donal Walsh, our AEO. And we are primarily a support service for the further education training sector. However, we do run, wellness awareness, or there may be some trainings that we coordinate with the Learner Focus, which will be maybe offered out to GRE2B as a whole. So the Learner Support and Inclusion Service is, for as far as reasonably possible, that all learners are provided with the supports required to allow full engagement and benefit from the educational opportunities available while participating in a course offered by GRE2B. So this is from all courses, whether they're full-time or part-time, level 3 to level 6 with GRE2B. So the Learner Support Inclusion Service is a free and confidential service, and it is for anyone experiencing barriers in participating in further education and training. We're not prescriptive about what those barriers are. However, I have just a few examples here that there are barriers out there that a learner might experience in trying to further their own learning and education. There may be some mental health needs. There may be overall health needs. They might be suffering from a long-term illness or something like long-term COVID. Members of certain minority groups have always faced certain barriers in trying to access services. There are people seeking international protection, people with disabilities, which we will be talking a little bit more about, as well as people with additional learning needs, which might be particular diagnosis around dyslexia or dyspraxia, dyscalculia, or there may be other additional learning needs. And people also might be experiencing certain socioeconomic barriers, particularly in the high cost of living we have going on at the moment, all the pressures that are on people, never mind then the pressures trying to go back and access learning or education. There are often costs associated with travel, with trying to access your course, especially around Galway and Roscommon, and for people who might live rurally. And so we have some supports to try and mitigate some of these barriers. So when we were formed, we came up with 4 objectives. And these are that we will coordinate existing learner supports. There's always been learner support on offer with GRE2B. Our setting up our team was just to try and bring this a bit more cohesively together. And also to look at developing new learner support initiatives that may not have been there previous to 2023. We also looked at providing localised based hubs for learner support across GRE2B region, and spearhead inclusion initiatives throughout GRE2B. So that might be bringing awareness around certain inclusion initiatives, where that might be training or bringing awareness around difficulties that certain members of our society may face. When I say providing localized based hubs, I will take this opportunity to introduce our team. So we are now in place since really began early last year, but really started implementing the service in September 2023. So it's still quite new, and we're learning a lot, and we'll be tweaking as we go along. So as things change, we would hope to roll out more of these, just to keep you informed of what we do and try and ensure that there is communication. So our learner support advisors, you might see some of their faces popping up on their screens. They have their cameras on. So first we have the lovely Anne Mannion, who a lot of you will know. And she is our go-to guru for everything with GRETB. Anne is based in County Roscommon and is responsible for rolling out the support service amongst the vet centres in Roscommon. And she is currently based in Lisnamult, there in Roscommon town. We also have Celine Gregory, who is based here with me in Merview, but works with our vet centres in Galway City and Connemara. And we have Jason, who came all the way from Scotland to work with us here, and we're delighted he did. And Jason works in North and South Galway, and is based 3 days in Tuam, in Chapel Street, and 2 days in Loughrea. So we can send out all our actual contact details, our emails, to participants if they want to. But if you're in an area, those are the guys that you can link in directly with. So today we really wanted to spend just a more specific time looking at if there are learners with specific needs. How can the learner support service help? So there are so many specific needs that people may have, and this list is not restrictive. It's open-ended. It may be for what people come to us disclosing what their need about. But I just wanted to say, we recognize there is no such thing as a homogenous learner or a student. Like I said, there is nobody. Everybody walks in the door with a story, and whatever that may be, education and learning has come along so far where, you had to fit into a certain mold to be the student. It was quite prescriptive, but now we recognise everybody has their own story and may have had to overcome a lot even just to get to that door. So these are just a few certain things where we may need to put in some specific supports around these, such as having a physical disability or maybe mobility needs, maybe that people have an issue with their walk, after surgery, or there may be some other, an actual diagnosis. There are people with various intellectual disabilities who we love to see involved in our education. There are people with sensory processing disorder, neurodiversity, the neurological condition, maybe like an epilepsy diagnosis. We mentioned dyslexia, dyspraxia, dyscalculia as well. There may be people long-term illness, who are blind, have vision impairment. We have a lot of members of our deaf community engaging, but there also may be people with just hearing loss. Their hearing has disimproved over time, and they may need a little bit of extra help in engaging in their class. That they may not have a hearing aid, but find it difficult to hear, but there are supports we can put in place. We also have a lot of people on the ASD, so autism spectrum disorder, ADHD. For people with prior mental health issues or current mental health issues, or they're recently dealing with mental health issues, whether that might be anxiety or actually have a diagnosis, we like to look at what supports we can put in place and help proactively plan around that. And then any other disclosures that a learner might bring to us or a student might bring to us, where they say that I have a specific need that I need help overcoming. So what do we do when somebody comes to us then? And I will talk about how learners can be referred. We look at, there are a two-step approach. When somebody comes in to us with a specific need, the first thing we look at is doing a learner support needs assessment, which helps us it's another way of having a conversation just to try and filter down what exactly is the need. And that'll help us plan what supports are put in place. This is done in conjunction with the learner. And if they want to bring somebody with them to help them communicate this, that's okay as well. It's all learner led and it's all done with the consent of the learner. So I'm going to share sort of a generic, this is an anonymized needs assessment. It's not reflective of anyone in any of our centres. We can also send out blank templates to people if they want to explore it in a bit more detail. If you just give me a second now and I do, this is where I get a little bit anxious is around sharing new screens. There we go. Can everybody see that? If you just give me a thumbs up, Angie, great. Thanks, guys, because you never know. So this is an example of our learner support assessment. As I said, we can circulate a blank one out to people if you'd like to see it. So this is an example of a learner called Joe Smith. They're doing creative textiles, and they have said that they have specific needs that they would like us to help them with. So the first page is just like a very brief description of the course. So it might be listing the modules and also putting down to see if there is any field trips or outside of the centre activities that will be part of that course. So here then the person would maybe highlight to us exactly what the specific need is, if they have a medical diagnosis or if there is a specific disability. So here the person has disclosed that they feel that they're on the autism spectrum, that they do have some sensory issues. They have a moderate visual impairment. They do suffer with some anxiety. They have some mobility issues due to their visual impairment, which would be poor coordination and navigates the environment with the use of a cane. So they are where we've highlighted what the specific needs are. We also ask, have you received any other learning supports in a previous environment, like in secondary school? So for example, this person has had support in secondary school and had a reader and a scribe for academic support. So that helps us understand what they're used to. Sometimes the learner, obviously they know exactly what it is that they need to have help with because they've been involved in learning and education before, or maybe they don't. And that's why we use this assessment, is to try and tweak and figure out what is it that would be of benefit. So we look at the impact of the support needs within the learning context. So this learner, for example, has identified that they need the support for the following to happen in order to increase their class attendance, to help them to be engaged during the class, being comfortable working with sharp materials due to the nature of the course, to have an appreciation of colour through other eyes, to feeling independent and feeling more involved in their community and meeting new people. So there would be a wider context probably of a discussion. This might take a few meetings, just one brief meeting. The learner support advisor would be just having a conversation with that person, and they would agree a certain support recommendations. So here, for example, it was agreed to put in class support, also having advocacy support. So it might be that the learner doesn't feel comfortable in expressing these needs to others and has asked for some advocacy support from the learner support advisor, and also some personal assistance. So we detail that down further. What would that look like? What would that personal assistance be? So that's assistance with gathering materials in the class, in-class verbal support for tasks and orientation around the centre, help with making tea at break time, and that there is a third-party service provider involved who is helping with the transport to the door. There is no personal or intimate care or assistance of meals needed. and maybe just assistance with making a cup of coffee. So having this helps us then, we can detail then when we go to an agency looking for a personal assistant, saying this is exactly what are the tasks that will be required from that personal assistant. We also look to see if there's any assistive technology recommendations that could help the learner. They may already be using certain AT, but there may be others out there that they're not aware of. So for example, here we could make the learner more aware that there is the Dolphin Easy Read through the NCBI app or now Vision Ireland, and also the Seeing AI, which is an app that people can have on their phone. It's a Be My Eyes software. A lot of people who are vision impaired or blind are utilizing this already, which will basically scan the room and tell them what is in place in the room already. If there is, from our consultation or a needs assessment, there is a possibility of an onward referral, either internally in GRETB, we would talk about that with the learner and with their consent, do that onward referral, for example, to our guidance information service, that they, in meeting with them, we realise there's actually more around guidance around the course and what they want to progress onto. And also the guidance service would refer learners to us then as well too after meeting with them. And there might be some external supports that are needed, such as offering access to counselling services within GRETB. We go through their consent and talk about their processing data. So these are some of the things that is gone through in detail with the learner. So one of the things, for example, the supports, the needs assessment is only kept between the learner support advisor and the learner, and it's kept on file securely, and it's destroyed after, it'll only be kept on file for a year maximum after they complete the course. So if the learner doesn't commence a new course after that, it is then destroyed. So regularly we'd be going through our records and making sure we have nothing kept that we shouldn't have, because we're holding a lot of personal information and we want to make sure that it is treated appropriately. So then there is the both signed of the learner and the assessor. So if I just go back to my presentation. So that's our first step. And then that might be all it is. You come with an agreement and we put the supports in place. But if there is a document that they need to, that the learner would like to show their tutor or their teacher, the course, the centre manager, or to bring to external agencies, we formulate that into a LENS report. It's a learner educational needs summary. And that's one of the reasons we wanted to do today, so people are familiar with this language, that we're not just introducing jargon, but this use of this word is quite familiar with further education and training, and also in higher education and the overall tertiary sector. So we have had examples where learners have come to us and they've already had a prior LENS that they'd like to show to us, that they brought maybe from an Access course with the university. And that helps us then in formulating what their current LENS would be. The LENS is sort of like a passport that you can bring to your educator and explain these are the needs. It's a need to know basis. It's just a summary, I suppose, of what has been agreed outside of the needs assessment. So if you bear with me, I'm going to show you an example of the LENS that we would have done for that person, that based on their needs assessment. So for our Joe Smith. So this is following doing the supports assessment, and it can be shared with the course coordinator and relevant tutors with the active consent of the learner. So this section 1 would just be a very brief information about the learner, that they're visually impaired, they have poor coordination, they use a cane to navigate, They're receiving assistance in travel. They're new to the centre, so they need orientation. They're aware of some assistive technology to help them, such as Be My Eyes, and they work to act as independently as possible, that they express they have some sensory needs, that they may need assistance in making tea or coffee on lunchtime breaks. That the learning supports required will be that a PA will be arranged by the Learner Support Service for in-class assistance, that these are the duties that will be done by that personal assistant, that the Learner Support Advisor will look at putting Braille signage on doors and on the centre's various centre map directions to help the person navigate, and they'll be linking in with any updated AT. And then if there's any other supports, just to talk about the assisting class and with navigation with the PA. And that was noted here that the accessibility within the centre is great, with wide corridors, accessible toilet, classrooms laid out well for movement. We flag at this stage if we feel that there will be accommodation sought for examinations or assignments. That's only more to let people be aware. And here it is no, because it is not part of the course. So that's the lens. And again, as I said, we can share out blank templates of that to people if they would like to look at that a little bit more. I'll just bring us back here, sorry. So that is the work that we would do with somebody, a learner who has specific needs. We do have other supports that are available that a lot of people might be aware of already. So we have been rolling out the laptop loan scheme since September, where a learner can apply to us for the loan of a laptop for the duration of their course. Just wanted to highlight, we are expanding this scheme to other devices. So for example, we were lucky to purchase iPads at the end of last year, and we would be able to loan out an iPad to a learner around a specific need. For example, if somebody wanted to trial a piece of assistive technology software, if there was something like a graphic design thing that they would like to do, or a mind mapping software, we're getting those set up now. We would have control of what apps are downloaded on the iPad, and it would be tracked as well. There are other devices that we would loan out directly to learners, such as C-pens, if somebody has a dyslexia diagnosis, or ADHD, or reader pen, which would help them with reading their information. We would hope to have other devices too, like, with Apple Pens or LiveScribe pens, which helps people record certain amount of a class while they're writing their notes, if they have a problem with keeping their attention. We also provide Irish Sign Language, of course, to members of the deaf community. We support people to access counselling. We do have, along with our colleagues in guidance, provide tokens to people who want to access counselling. That is online, but we are looking at trying to put in place face-to-face counselling for people who feel that the online would not work for them. So if people just want to contact us directly about that on behalf of a learner, or learner can contact us directly themselves. Put in place learner advocacy, the Learner Assistance Fund, which we rolled out a couple of times last year, which is a small amount to try and offset certain barriers that people might be experiencing, such as travel. There will be details for the Learner Assistance Fund for 2024 coming out in the next few weeks. We're just tweaking that at the moment. We look at running wellbeing and inclusion initiatives directly for learners, and we do look at running out some training as well, but always with a learner focus. So, for example, an example of that would be maybe running out mental health first aid training, with an idea of training up staff to be available as first aiders if people are having some difficulty. Here are some examples of areas that aren't covered by us at the moment. We do not have any involvement with reasonable accommodation of exams. This was because of the agreement with senior management and QQI, because there is so much involved with the actual, what is involved with the assessments and what the obligations are with the QQI. We don't have any involvement with that. We might just flag that somebody may need it, but the assessments is down to the centre managers according to the guidance of QA. And so following on from that, it's the same with organising scribes for the purpose of exams. We would look at the in-class supports for people while they're participating in their learning. We're not available for like crisis intervention because down to capacity, we're a small team and we're spread over a big area. So if somebody was, presenting in crisis at a centre, we would not be available to go in that immediate moment to try and help them. What we would be available for, though, is proactively supporting people around their mental health. If people wanted to refer to us for supports and plan that out to discuss what they might find difficult in class and how we can support them around that. We don't provide IT support or career or course guidance, the writing of CVs or administration, or looking at learning skills like academic writing, doing research or proofreading. So I just wanted to go through that just to try and clarify in case there was any confusion for people. So for a learner, how they can access our supports is like a self-referral. They can register online. It's on our GRE2B website. That's our address. Or they could, if you just put in GRE2B learner support into a search engine, it brings you directly to that page, and the links for our English form and our Irish form is on that. On our documentation too, we have that QR code. If that's challenging for people, they can the learner can speak to their course coordinator, guidance counsellor, or their local learner support advisor who will help, or send an email directly to learner support at GRE2B to request a copy of the registration form. So thank you for listening. These are our contact details. We have a number there if you want to take a picture of it. It's 086 061 7944, or you can contact us on learner support at gre2b.ie or on our website. Again, if anybody would like a copy of these slides, we will circulate them out. So we have time for some questions if anybody wants to ask us a question. Now, if you don't feel doing it on a Zoom, you can contact us after this. That's no problem. So I'll just give you a few minutes. If anybody wants to ask a question, just take yourself off mute.
Thanks, Deirdre, for the overview. That was great to get an overview of the service.
Hi,
that will help
Alison.
hopefully, how you complement our own service here.
Yeah.
I'm just wondering, you mentioned mind map software. I'm wondering, have you experience of what ones might be good in that area?
We've been exploring them. Jason is our assistive technology researcher, you could say. And especially now that we have the iPads, we do have a list of some examples that we could forward on to you, Alison.
Great.
If it's something you'd find useful. Yeah.
Okay. Thanks very much. That's great.
No problem. You take a note of that, Jason, if that's okay. Thanks a million. No, if that's it, that's okay, because I'm sure people are hungry, and I really do appreciate you tuning in. It means a lot to us here, and as you said, we are recording it and we can send out a link. We've had a few requests for that, but if you think of something after this, just contact us individually or send us an email at learnersupport@gre2b.ie. Okay, thanks everyone. We'll take care.
Well, thanks very much. Thank you.
Bye. Thanks very much. Bye bye now.
Thanks everyone. Slán.
Slán.